7% of the general population, and females are the most common gender in the disorder. And mostly it happens into childhood, adolescent, or adulthood. In older age is relatively less common. And about a quarter of the patient with acute somatic symptoms, they transform into chronic somatic symptoms. So as I mentioned earlier, the common risk factors in this population, which is more in female than in men, is a low socioeconomic class, older age, low education, childhood sexual abuse, concurrent physical or psychiatric illness, and history of substance abuse. So these are the risk factors you must evaluate when a patient with vague symptoms come to you. So now if we go back to the actual diagnostic criteria according to the Diagnostic and Statistical Manual, so here the first stream is one or more somatic symptoms that are distressing or result in significant disruption in daily life. And this person always thinking excessively about thoughts and feelings and behaviors which are related to somatic symptoms or associated health concern as manifested by one of the following. So among all these three, one must be present. One is disproportionate and persistent thoughts about seriousness of the problem, persistently high level of anxiety about health or symptom, and excessive time and energy devoted to these symptoms. So out of these three, one must be present to officially diagnose somatization. Now, there are certain specifiers with this diagnosis. Now, it could be associated with a predominant pain, and or it could be a persistent variety where there's a severe symptom, marked impairment, and long duration, which is more than 6 months. So then it's called persistent. And then about the severity of the problem, it could be either mild, moderate, or severe. So this must be kept in mind when diagnosing this problem. From the pathophysiological standpoint, a variety of elements have been discussed, including genetic causes, biological causes, and some people have heightened awareness of normal body sensation, which is a part of a special cutaneous sensation. And early traumatic life events such as neglect, physical or emotional abuse, or sexual abuse is also considered. So the early trauma, as you mentioned earlier, it could be emotional, mental, physical, or sexual abuse. And then there are certain cultural and social factors must be kept in mind, which should be always discussed with. And these are like some cultures that devalue and stigmatize psychological suffering compared to physical suffering. That means they give more value to the physical problem rather than a psychological problem, and they just shun off to the patient that no, this is all in your head, there's nothing there. So they devalue and stigmatize the psychological suffering. And besides that, in various cultures, how a person identify a sensation, interpret illness, and seek medical help. So this varies from culture to culture. So these factors must be considered in mind in somatic symptom disorders. The early trauma, which could be neglect, abuse, chaotic lifestyle, alcohol and drug abuse, and family dynamics, dysfunctional family dynamic. These are the important elements of early life trauma. And there are certain abnormalities in tryptophan metabolism have been found. Alexithymia, when a person is unable to express his emotions. And sometimes parents also somatize their symptoms and child learn from them. So these are the pathophysiological aspects of somatic symptom disorder. Culturally, stigmatization and devaluation of psychological symptoms we just talked about, and how the patient and family identify those sensations, interpret illness, and seek medical help. And modeling is when a person learns these behaviors from their elders and parents. So these are the different variety of symptoms you can see, starting from just pruritus, pain, burning, numbness, sensation of soreness, blotchiness, paresthesia, and all these symptoms you may find in somatic symptom disorder. And clinically, when a patient presents with a somatic symptom disorder, is either it could be a pain when there's no obvious reason is found, pruritus, itching, burning, or stinging. And you must have heard about the cutaneous sensory syndrome, which is the hallmark of this problem. And all these presentation you can see in any kind of cutaneous sensory syndrome. So how cutaneous sensory syndrome is defined? When a major bulk of somatic symptom disorder happens which are unpleasant and disagreeable, lacking neurological, psychiatric, or medical explanation, and the patient presents with burning, tingling, pain, and stinging. So there are two major areas of the body, the head and perineum, which are the most commonly involved in any kind of cutaneous sensory syndrome. When you're talking about head, glossodynia, which is burning mouth syndrome, you must have heard about that, scalp dysesthesia, trichodynia, the pain and the roots of the hair, and idiopathic scalp itching. While in the perineal part, vulvodynia, urethral syndrome, anodynia, which is the pain in the anus, and perineal pain syndrome. Now keep in mind that all these symptomatology have no organic or physical cause available. Sensitive skin, this is a new concept relatively, and here the person's skin is very hypersensitive to any kind of stimuli. Pathophysiologically, and these people have impairment of epidermal function, which is the increase in transepidermal water loss, decrease stratum corneum hydration, and increase skin pH level. And these people have always there's a psychological stress, and there's a dysfunction of neuroimmunological functions. And certain skin conditions have this sensitive skin. Now here you can see there are various subsets of somatic symptom disorder you can come across. Illness, anxiety disorder is one form, and there are unspecified somatic symptom and related disorders. There's a factitious disorder, psychological factors affecting medical condition, and functional neurological symptom disorder, which is convergent disorder. So these are all the subsets of somatic symptom disorder. Now there are a variety of skin diseases which may display somatic symptoms. The most common is psoriasis and psoriatic arthritis, atopic dermatitis, nodular prurigo, and vulvodynia, male genital dysesthesia, burning mouth syndrome, trichodynia. So all these conditions have somatic symptoms. So how to diagnose and what are the helpful pointers? You must ask during the interview or notice during the interview, display somatic symptoms. The most common is psoriasis and psoriatic arthritis, pointers. You must ask during the interview or notice during the display somatic symptoms. The most common is psoriasis and psoriatic arthritis, pointers. You must ask during the interview or notice during the display somatic symptoms. The most common is psoriasis and psoriatic arthritis, pointers. You must ask during the interview or notice during the display somatic symptoms. The most common is psoriasis and psoriatic arthritis, pointers. You must ask during the interview or notice during the display somatic symptoms. The most common is psoriasis and psoriatic arthritis, pointers. You must ask during the interview or notice during the display somatic symptoms. The most common is psoriasis and psoriatic arthritis, pointers. You must ask during the interview or notice during the display somatic symptoms. The most common is psoriasis and psoriatic arthritis, pointers. You must ask during the interview or notice during the display somatic symptoms. The most common is psoriasis and psoriatic arthritis, pointers. You must ask during the interview or notice during the display somatic symptoms. The most common is psoriasis and psoriatic arthritis, pointers. You must ask during the interview or notice during the display somatic symptoms. The most common is psoriasis and psoriatic arthritis, pointers. You must ask during the interview or notice during the display somatic symptoms. The most common is psoriasis and psoriatic arthritis,
pointers. We must employ some game as you are never this way of symptoms. The most common psoriasis are natural pointers. We must employ some game as you are never this way of symptoms. The most